The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in general dentistry? With us, we have an expert on the topic, Dr. Don Brown. Dr. Brown, welcome to the program.
Thank you, Randy. It's nice to be here.
Always a pleasure to have you on the show. Now, before we get into today's topic, I guess tell us a little bit about your practice. You're originally from Crested Butte.
Correct.
Is that right?
Right.
Okay.
Years ago.
So you do all types of procedures.
We do. It takes a lot of study time. We do everything from cosmetics that we've talked about in the past. We see emergencies on a routine basis, particularly in a ski town. There's traumatic injuries, some toothaches, and everything that everybody else has.
You see a lot of those, by the way, a lot of emergency patients?
Fair amount. Pretty aggressive group of people. Skiing, mountain biking, any type of outdoor activities, horseback. So softball injuries, that's a big thing in town. So sometimes we get some facial injuries with softball accidents. So, you know, and it's we do fillings and we'll do crowns. We do a little bit of everything, and cosmetics is something I've always enjoyed. So
you do some dental implants now?
Do dental implants, both surgical placement and then the restorative later on.
So you use the periodontist or the prosthodontist?
Endodontist. There are definitely indications for specialty. I pride myself in being very good at what I do, but I can recognize, you know, Randy, Dr. Pete Dawson is a great mentor for a lot of dentists in this country, me being one of them in St. Petersburg, Florida, in his teaching group. And he came out with a statement called WIDIOM, W-I-D-I-O-M, and it means, would I do it on me? So that's kind of, if I feel like my family member is better treated with a specialist for a particular thing, then I'll refer them. So it's an easy way to determine when you're going to refer someone and when you're going to do it yourself. But we're in the mountains. We work very hard at staying up on implants, the indications for implants versus root canals, and how you diagnose these various problems.
I understand one of your patients is very famous. He's me, right?
Right. Yes.
Kidding about that. No, but you're my dentist. And did some work, just a couple, kind of made my smile bigger a little bit.
Let me review it.
Well, you got my photo here.
I have your photos here.
All right,
I carry them in my wallet all the time.
Look a lot younger back then.
Yeah. Well, this is, as you know, this is how you came in. You had a few things that were on your mind a little bit. You had some discolored fillings and you want to broaden your smile.
You said, you know, Randy, I want you to go home and look at both sides of your mouth. You've got dark holes on both sides of your mouth. And in fact, it was on my website at the time. I looked and I had, and I go, wow, you know, this is, and you called it a narrow buccal corridor, right?
Correct, yeah.
And
good memory.
Tell me what you did.
Well, the first thing that we did,
it makes a big difference.
It does make a huge difference in your mouth, and I think you can see from the before and after smile photos. And if you recall, you had a little anesthetic still in your cheek when we took that, and so it's still a nice, big, broad smile.
So age ranges of patients now that are coming in?
Oh boy, great question again. You know, we see children, and I think the oldest patient I can recall having was over 100 years old. And I had a 96-year-old gentleman come in and want 4 implants. I mean, this guy
that right?
Came in real solid guy, carrying his briefcase. He wanted 4 implants, and age is no factor in these treatments. It doesn't matter if it's a root canal or an implant. It's all about how good's the bone, how healthy is the patient. There's no limitation in age.
So there's a lot of people, by the way, Colorado. I mean, like everywhere else, people don't like their smile, and they should do something about it. Invest in your smile.
Yeah, I think for certainly just find out what the options are. I think as we go through some of these photos, you're going to see the options. I think people just need to know what can be done. What could be done quickly? What's a short-term fix? What's a long-term fix?
So let's start with some examples.
Okay, well that's great. Shirley here is a wonderful lady, and we enjoy treating her. As all these patients, they have a place in my heart. We've had a nice time and good relationships. You can see from the top photo here, Shirley had quite a bit of problems from color, cosmetics. She had some bite problems here, cross bites, and it was time in her life she wanted to get it fixed. She just wanted to look nice, and she wanted to have a really comfortable bite.
What do they come in? What do they say? Like this shirt?
Well, everyone will typically have a chief complaint. They're going to come in and they're going to say, you know, it hurts, or I don't like the way my bite is, or my smile's crooked, or the color's bad, or whatever it is. I have pain in the upper left. It's 100 different reasons they might come through the door. And so with Shirley, we talked about the pain, we talked about the color, we talked about the bite, and the more that we talked, the more questions she asked, and showed her some pictures of patients we treated. And I think you can see she elected to go ahead, and she had some root canals and bite problems and new crowns, and so she elected really to take care of those, but in the meantime, she wanted a beautiful smile. She wanted to leave with everything right. And so that's what general dentists do. We have the ability.
I mean, it's a big difference in that smile, by the way.
Yes, it is. I mean,
And,
Shirley's in her mid-70s.
Is that right?
Yeah.
I mean, look how young she looks with a smile like that.
Every time I look at these pictures, I just look and say, wow, I mean, her hair was different, just her attitude. She wrote a very funny thing on her, it's a little poem for me on her photo we took later on. But it was a very gratifying case to take care of Shirley. It's just one of the things, general practitioners can do these things. They can do the root canals. If you've had training, you talk about the training. If you've had training, like at the Dawson Center or other people, Frank Spear, John Coyce.
Is the goal, by the way, because people don't like going to the dentist, right? I mean, that's a fact.
Right.
Okay, so you go to a place where they can do most of what you do is you don't have to send out. Even though you use specialists, but I mean, you can pretty much do everything right there.
I think a patient comes, they want to know with predictability what the outcome's going to be. They want to know, can they do it all here? Are we going to refer them to a specialist? And some of these cases require a lot of time. So it's outcomes. People want to know about outcomes.
Now, when I went into your office, okay, and you have pictures on the walls and people like sign them.
Right.
You still do that?
Oh, sure. It's fun.
Yeah. But you showed me a smile of like 10 other guys or women that had smiles just like mine. Mm-hmm. And so you have this huge collection. So when a woman like that goes in, she's in her 70s. Right. That's what you do. You show them a like smile, or do you use computer imaging?
I don't use imaging. I used to use imaging. And I think some of the things that are a problem with the imaging that I use now may be better now, but I'd rather show them work that I have done. And I think the bite is so critical to the success of anything, whether it's a single filling or a single crown or a full mouth. The occlusion, the forces have to be managed properly.
The bite, the way the teeth come
together. The bite
together.
is. And a lot of these computer images don't really account for that. So there's some things that I need to know. We do wax ups, and I can show you one of those right now.
Let's take a look. Let's take a look.
Okay. This case, Shane came down, and you can see tremendous wear. He was a mountain climber, and he used to put these carabiners in his front teeth. He used for his mountain climbing. He kept cracking and chipping, and so he wanted to. His father-in-law actually suggested he come see me, and so in order to do this, we had to work on his bite, and I couldn't just do it by looking at it. So we have to take impressions, have lab wax this up. You can see this is a mock-up in wax. Every dentist knows what these are, and that way you can determine the bite, everything before you touch the patient, and it's very predictable at that point. So if you go from the before, and then you work down to the wax up, this is our working model here, and then we move into the before and afters of Shane and how it turned out. You can see it was very predictable. We did all the upper teeth. We did 4 of the lower front teeth, and that's exactly how it turned out.
Very nice. What do they say after that's done to you?
It's a variety of things. I think it's just I can smile again, things like that. It's just thank you for giving me back my smile. Just, if there's 100 people, they're going to say slightly different 100 things.
Are you ever, you've been doing this for quite some time.
Right.
Are you ever surprised at the results you see, or the changes in people just because you fix their smile? I mean, are you still surprised?
I'm surprised if I don't see the changes. That would really surprise me. I'm expecting it to me. I've seen it too many times, and it could be 4 teeth. I mean, it's not like these cases. Let me show you one more large case. These are very sophisticated cases. These are not maybe for everybody to do. But Jan was my nurse, actually.
Oh, my goodness.
And she smiled, and I said, Jan, what can I could help you. Come down, let's just talk about this. And so she came down, and we, without going into a long story, we did the same thing. We do it for every single case. We do the wax evaluation of the bite and the contours of the teeth. And you can see the close-ups here, the before and the after. Now, this is how she left the office the first day. That's a temporary.
That is absolutely a beautiful smile.
That's about 4 hours later, and this is within 3 weeks, and this is her facial shot 3 or 4 weeks later. So without getting into the details of Jan's case.
But a before and after like that.
Yes.
I mean, that kind of a transformation. You take a woman that never smiles, and now she's smiling. I mean, does she get emotional when she looks at herself in the mirror?
It's like we're on the same wavelength sometimes. If I go back to these photos, on the top photo, we have the before.
Yeah.
This was 3 to 4 hours later. And
right?
So she sat up. Well, those are her temporary crowns. And they're made from the wax up. That's why we do the wax up. We know exactly what they're going to look like when she leaves. I'll show you another case if we have time later on the wax up. But she had temporary, and we sat her up and gave her a warm towel and gave her a mirror, and tears rolled out of Jan's face. Just tears. Like she had grown up with this. You imagine being 13, 14, 15-year-old young lady in high school, and those are her teeth, and here she is maybe 30 years old, and she's a nurse.
Do people not know, you know, you mentioned that earlier, and the people don't know their options. So like when she comes in, she doesn't know that anything could be done?
I don't know if she had a clue.
Right.
And I'll tell you, if she had done that with a bonded filling material, it would have been an improvement, but it wouldn't have been anything like that, I don't think. At least not in my hands. You know, I don't know that anybody can get those results with bonded filling material and have it last a long time. So that was a very gratifying case. You can tell.
You're a dentist. You think the smile's pretty important.
Yeah, everybody thinks it. I think most people in business think it's important.
Okay.
I think if someone comes to our office and they want to interview, it's not because I'm a dental office. It reflects how what we think, you know, reflect on the patients that come in. I have hired really good people, but we fix their teeth. So we all know it's important. There's no question it's important. It's at what level of importance is it to an individual. I think for some people, function's more important than the smile. They want to eat well. They're not terribly concerned about if they're yellow or a little bit spaced or crooked. There's a lot of people like that, and I'm very content with that. You know, as long as they're healthy and they're comfortable, I'm great.
So in this economy, by the way, invest in your smile, you say.
You know, it's I agree to that, but I think that we all know there are people that are having trouble paying their car payment, and that's the most important. But I do think that if I was going to send a message, it is invest in your smile. Let's make sure you're healthy. Let's make sure you're comfortable. And there'll be a time down the road if you want to invest in your smile, that's fine. But let's just make sure everything's healthy.
So hot and cold sensitivity, loose teeth,
anything,
bad gums,
yeah,
get that taken care of.
Yeah, anything.
Okay.
Yeah, I can show you. I want to show you this case. This is an exciting case for me. It's not the cases we just looked at.
We got a smile out of you, by the way.
We did?
So you must be excited about this next
I got to
one.
stop that nonsense.
Okay.
So this case is a very important case to me. It tells what can be said. There's a lot of people out there who have cavities. They have gum disease. They may have bad breath. They may be thinking, my mother had a denture. I'm going to have a denture. And they may be just down in the dumps about it. This lady had tremendous fear, but she had a toothache and she came to see us. She heard some nice things and she came in, but she could hardly look me in the eye initially. And we took some photos after about 2 or 3 visits of talking. And I think if you look carefully at this top photo, you're going to see at the gum line, you're going to see a lot of redness, and you're going to see gum cavities that are very accessible to the toothbrush. There is no reason that she has to.
You say she couldn't look you in the eye?
She could not initially.
Why?
She was so scared of dentistry.
Okay.
Well, I believe that's what kept her away. No one wants to have these problems. Nobody wants to have gum problems and pain and bad breath and be embarrassed to smile. Look at the dark, that's tartar down there. That's all that is. That's not even a cavity. And look, see how red and swollen the gums are. And so this was so gratifying. Within 3 weeks or so, if you look at the front 8 teeth on the top and the bottom, those are fillings, tooth-colored fillings. Look at the condition of the gum. All that redness is gone. This nice and light pink, all this black's gone. Look how healthy those are starting to get. Anyway, she came back for subsequent follow-ups and after several months, and her attitude was totally changed. She was totally at peace. She was comfortable. You talk about sedation. She had nitrous oxide, and we gave her oral tablets initially so she could just come in and she, you know, we might push her on the shoulder. How you feeling? Oh, I'm good. You know, she just really wasn't aware of what was going on. And she got up and walked out, and her husband drove her home. And as time went on, then we just give her a little nitrous oxide. She was fine with that. So it's confidence. If you have confidence, your treatment people, the staff, not just me, the staff, and relationships start to form, then everything changes for that patient. It just changes.
Okay, and what do you call your kind of a practice? I mean, I think of you because you help me, cosmetic dentist, but you do all of that stuff.
I think it's general practice. I mean, just means that if you have a toothache, I will get you comfortable. If you have a cosmetic problem, I'm sure I can solve it.
Now, those guys in the Olympics, you know, the guys that do everything, what are they, decathletes?
Decathletes,
Are you like a dental cathlete or something?
I think a good general practice.
good in a lot of different areas?
Good general practice really needs to be. There's some people that may not like doing root canal therapy, for instance. Maybe they never got comfortable with it, and so they'll refer it all out. I happen to enjoy most of the things that we do. Yeah, it's kind of fun. You never know what day's going to bring you.
At the top of the show, we talked about small things.
Right.
I talked about it, actually. Small things can make a big difference. And so it doesn't have to be a full set of veneers in the mouth that can make a big difference. So
in
show me
fact,
some examples.
I think, in fact, it's probably more times it's not the full case. It's using your imagination. This young lady had braces, and you can see in this photo, it was the first time we got together, you see the little spaces there post-operative with the braces, never closed them. I said, well, let's see if we can't get those retainers to do a better job. She came in a year later, and you see the spaces are even larger.
So she went to the orthodontist.
Yeah, it didn't seem to help. In fact,
is that right?
It didn't seem to help at all. So you can see the space right there got bigger. That's about a year. And then you can see we just did 4 veneers here. And we made her a protective night guard so that she can wear that on the upper arch. It's basically an orthodontic.
Very pretty girl.
Oh, she's beautiful. Beautiful case, beautiful laboratory. I couldn't do these cases without these labs. These guys are true artists. They are true artists. Let me show you Vicki real quickly.
Right.
A couple of quick cases. Vicki needed a variety of things. She had some stained old restorations, some overlapping teeth. The gums aren't the same level. So you'll notice we got the gums right, the bleach right, the veneers are beautiful. And look at her different presence.
Yeah.
It look like a different woman, doesn't it?
Very nice.
It's a beautiful case, and
there's a certain sophistication in class when you see a woman, or even with a great smile, nice set of teeth.
I'm sitting next to my wife on an airplane. I'll see her magazines, and I'll be caught to that smile. I'll have the ads and the thing, and I'll see those smiles, and it really is beautiful.
You have to have an eye for this, don't you?
You do. I think you do.
I see bad work. Look, this is one of those, you are my dentist. I should mention this. And people, especially in Colorado, my show airs, I'm interviewing different dental specialties. I could go to any dentist in the world, and I go to you. And I should mention one other thing. If anybody goes to his website, and by the way, this is a real interview. People need to know that.
Right.
That you're not paying me to say this. That your before and afters are the best I've ever seen. I mean, these are and people also, I think, need to know. And this is one of those educational shows where it's real in this case, that not every dentist is doing the same work. I mean, not even close.
Well, I think you can go to a lot of websites. Go to Cosmetic Dentistry, just pull up websites. I see cases that would embarrass me, but honestly, the people that put them in think they're beautiful.
That is an interesting point you just said.
They are proud of their work, and so someone might look at mine and say the same thing. I mean, I'm not going to sit here and
yours
criticize.
Yours aren't big and bulky. I mean, they tend to follow the lip line.
Let me tell you a big factor. It's how much money are you willing to pay the laboratory? I can get a veneer done for $80.
Okay.
I can get a veneer done for $450. It depends on where I got this case. Do I send it to this lab? Do I send it to this lab? That's a $300 and some savings or expense for me.
I better not find out you gave me cheap veneers. Okay.
I hate to say it, but that's where crown and bridge fees will vary. And it's interesting because we all know in life paying a lot doesn't necessarily mean you get a good job. And that's so we try to keep our fees very, very middle of the road. And our labs make this work. I direct them, but they have to do the ceramic.
But the shape of the teeth,
that's where the wax up comes in.
Yeah, the shape of the teeth in yours, because look, you do regular people that don't have jobs, people that are retired, and some of the most famous people in the world are also your patients.
Right.
And so I think and I think the message here is look for a dentist, look at their work. Is that right?
I would love to see a product of what this fella did or this lady did. I'd like to see something compared to my problem, and I'd like to see how they handled it. That's all. I'd like to know what the sequence of events is. How do I get predictability at the end of the road? And it all comes back to the proper x-rays and the wax ups and all the work up in the front. All the work's up front. Like a good architect builds a beautiful building and it comes together. Why? Because he did everything up front properly.
But no job is too small for you. I mean, that was one of your messages.
Well, let me show you this
today.
case. That's a great, it's a great thing. Here's a young lady, an orthodontist, another orthodontic issue. He was sent to me, and he sent this young lady to me, and he had this peg lateral. Well, this was a birth formation problem. The tooth is referred to as a peg lateral. He could not get this looking right. So it was a very simple case. We just did a one case veneer. And she was thrilled. Here's after she got her braces off. She was maybe 14 years old. I hardly had to drill that tooth at all. So it doesn't get simpler than that. It's just a neat case. Let's go into implants a little bit.
Okay.
Implants are a big thing these days. And when do you do implants? When do you do root canals? What are the indications? I'd like to show you this picture. I don't know if you can see it very well right here, but I think you're going to notice two fragments.
That's very graphic.
Okay. This is a patient that I saw about 14 months ago. And this tooth was not savable. If you look carefully, you're going to see the end of the root canal. You're going to see the post in the middle. That's a crown that she had. And this is the fractured fragment of root that was causing a gum infection. So I took this out. The same day we did a bone graft. And we waited about 9 months. And there's a reason, with more her schedule than mine. And we placed an implant surgically about a month ago. And there was no way that we could save this tooth, but she'd had invested a root canal and a post and a crown. Why did this fracture occur? My sense is that post was probably a little bit too big, and secondly, the bite probably was a little too heavy on that tooth. But how many patients come in my office and say, you know, I used to have a root canal in that place and a crown, and I lost it, and we were talking about implants. So root canals and crowns do great, and some of them don't. And so this is an indication for an implant. I'm going to go through 3 very quick cases with you. And let me say something about implants. There are regular diameter implants. Those are the ones most people think about. They cost more, they're stronger, they have much more restorative possibilities. We can, if a person has a crown on an implant and later they lose some teeth, we can take that crown off and we can use that same implant for an attachment for a partial denture or a denture. These are reusable in most cases. They're not, and that's a great thing that a lot of people may not be aware. On the other hand, that was regular implants, regular diameter. Small diameter implants are totally different. They're often referred to as mini implants.
Mini implant.
I have good friends who are surgeons that tell me that they will break periodically, which is not the end of the world. They can be removed and replaced. But if you have a patient with a denture, or you have a patient with a partial denture, and they don't want unsightly class, or they're having a problem keeping it in, maybe 4 small diameter or mini implants can be placed quickly. Many cases won't need a CT scan, cone beam CT scan to help you place them. So there's a distinct difference between the mini implants. They are different restorations, they are different procedures, and they have different indications. So I don't want anyone out there to get confused. Okay. So quickly, this is Dwayne. He's a character, as you can tell by his picture. Tell me that guy doesn't make you laugh.
Yeah.
I love this guy. But here he was, lost his central. He went around like that for like 5 years.
He did?
He did. Now, I did not surgically place this implant. A good friend of mine, Dr. Peter Shear in California, did. And then that was the crown that I did, and here's his smile. And you can see before and after, but he's smiling the same, isn't he? I don't know why we did it, because he didn't seem to, he asked me to do it, that's why we did it. But it was a fun case. This lady really does point out the age, lack of age limitations. Here you've got, she's mid to late 70s. She had 2 implants. These are regular diameter implants. And she had a bridge placed, and you can see it on there, how nice that is. There's no limitations on her ability to eat. Lastly, Gene, another character. He's probably my age, and he had some nubs over here, and this is a,
Gee.
Yeah. What a difference, huh?
It looks 20 years younger.
He really does, yeah. We talk about our specialties, and I want to compliment one fellow I've been using in Crested Butte since, in the 90s. This patient, I couldn't have done this case without his help. I needed some really more extensive gum surgery on this case, and you'll notice great amount of bone and soft tissue, and we got it trimmed down. Dr. John Drazik in Grand Junction, Colorado, a good friend of mine. And so anyway, we just did a nice, easy cosmetic case. Once he gave me the tissue levels I needed, this was really kind of a very simple and nice case. Lastly, one of our good friends and patients, friend of yours as well, I believe, author Ann Rice, she's honored us with coming to the office, and we were able to take care of her nicely. And
she's a well-known author.
Yeah.
Yes. I haven't met her.
Oh,
but I'm a fan of hers. Yeah.
Oh, yeah. Well, we'll have to get.
She autographed a book for me one time because of you. I asked.
She is one of the sweetest people I believe I've ever met, and I really enjoyed her and still enjoy her friendship. You can see that.
What a difference.
Yeah, she's in the public eye obviously a lot, and I think she enjoys her privacy, but she is, and it was a wonderful case. I won't get into details, but you can see the before and after, facial pictures, and it was a great case. This one did involve, Ann's included, we talk about general practice. There's a lot of elements to that case that we don't need to discuss, but it was a very gratifying case, as every patient is. They're just...
So you deal with like TMJ issues, you deal with people that are grinding. I mean, this is a big topic, general dentistry.
Occlusion is a huge topic.
Occlusion means bite, right?
Bite, balance.
This is your focus. I mean, you've been learning about this?
Well, it is until the patient comes in with an abscessed tooth, and then my focus is endodontic and get them comfortable right away. And it's all about accurate diagnosis and treatment options to the patient. But that patient's interested in going home and feeling pretty good. They don't, so it's what general practice is. I might see a 4-year-old with an abscessed tooth. I might, it just goes on and on, age 0 to 100, and every problem we see. We're the front line in dentistry. General practice is the front line. It's where can you take it for that patient? How far can you take it? When do you call in specialties? And it's just really, it's a matter of experience. I don't know what else, you just don't learn it all in school.
Well, you know, Dr. Brown, we're out of time. Final message, though, okay, on general dentistry in general, to patients out there. Maybe they're afraid of the dentist, haven't been to the dentist in a long time. Maybe just even a gap is bugging them, or hot and cold sensitivity.
Well, I think it all starts with a phone call. You know, you call the office, and if you like the sense of the initial contact, if it seems like it's a caring group of people and you're comfortable with that, come in. You can come in several ways to enter dental practice. You come in for just a consultation. You have a problem, can you come in and just talk about it? Do you want to have a cleaning? Do you is it time for you to have a bunch of x-rays? You know, it's just, there's a lot of ways to come to the practice. The idea is to call somebody that you are comfortable with, or you've heard will take good care of you, and approach it from there. The face-to-face meeting, we have a private consultation room that allows people the opportunity to sit there without overhearing from anyone else and talk about their concerns, their financial issues, what limitations, what their expectations are. I mean, it's a relationship, you know.
What do patients say about you that you like to hear? Where they say, Dr. Brown, they said this.
Gosh, that's a great question. Well, you always want to hear them appreciate the quality of your work, that they felt comfortable and confident, and that their interests are your interests. I think any time that the patient knows that that their interests are primary, then they're going to be extremely comfortable. So that would be my message, I guess.
Well, thank you for coming on the show. Good stuff. Always a pleasure.
Appreciate it.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you could actually go on your website. Will you have this on your website?
We will, sure.
Okay, and also, and this is really a recap here. Go to his website, look at the before and afters, look at what he does, look at his background. Very fascinating stuff. You know, great work. And of course, we'll also have it on our website at wellnesshour.com. You just put in Don Brown. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.
Tried all sorts of cover-ups for bad breath? Try the science of BreatherX. Only BreatherX has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreatherX from your dental hygienist and now at fine stores everywhere.
Hi, I'm Randy Alvarez, host of The Wellness Hour. We are currently looking for licensed health practitioners to be on the show. So if you have something to say, a great message, a new breakthrough, you have to let us know about it. Visit wellnesshour.com, click on how to become a guest, or just email me directly at randy@wellnesshour.com. If you know a doctor that you think would be great on the program, send them my way.